Q1. Kate, 50 years old, was admitted to the hospital with gastrointestinal bleed presumed to be esophageal varices. It has been recommended that she needs to be transfused with blood. However, due to her religious and personal beliefs, she needed volume-expanding agents. Unfortunately, she died a few hours after admission. Before dying, she said that it was God's will, which she believed was right. Which of the following statements is false? Health professionals should be aware of imposing one's worldview upon others and strive to be more receptive and sensitive to the needs of others. Individual choice, consent, and the right to refuse treatment is important. It is important for all health professionals to do any means to keep a patient alive regardless of traditions and beliefs. None of the above. Q2. You were on your rounds with one of the carers. You were turning a patient from his left to his right side. What would you do? Both of you can stay on one side of the bed as you turn your patient. You go on the opposite side of the bed and use the bed sheet to turn your patient. You keep the bed as low as possible because the patient might fall. You go on the opposite side and grab the slide sheet to use. Q3. Jones appears to be very confused today. He seems to be quite verbally aggressive towards staff. His urine has also got a bit of foul smell. How would you assess this resident? Check his papillary response to light. Collect a urine sample for MSU. Carry out the urine dipstick. BMC, none of the above. Q4. Mrs. X is diabetic and on PEG feed. Her blood sugar has been high during the last 3 days. She is on nystatin oral drops QID, regular PEG flushes and insulin doses. Her humulin dose has been increased from 12 IU to 14 IU. The nurse practitioner has advised you to monitor her BMs for the next 2 days. What will be your initial intervention if her BM drops to 2.8 mol after 2 morning doses of 14 IU? Offer her a chocolate bar and a glass of orange juice. Flush glucose syrup through her PEG tube. Ring the nurse practitioner and ask if the insulin dose can be dropped to 12 IU. Contact the general practitioner and request for a visit. Q5. An adult patient with nasogastric tube died in a medical ward due to aspiration of fluids. Staff nurse on duty believes that she has flushed the tube and believed it is patent. What should not have been done? Nothing should be introduced down the tube before gastric placement is confirmed. Internal guide wires should not be lubricated before gastric placement is confirmed. Auscultate the patient's stomach as you push some air in, and if you cannot hear anything, flush it. It is important to check the position of the tube by measuring the pH value of stomach contents. Q6. An 82-year-old lady was admitted to the hospital for assessment of her respiratory problems. She has been a long-term smoker in spite of her daughter advising her to stop. Based on your assessment, she has lost a substantial amount of weight. How will you assess her nutritional status? Check her height and weight, so you can determine her BMI score and nutritional care plan. Use the respiratory and perfusion assessment chart on admission. Check if she is struggling to chew and swallow, and make a referral to the speech and language therapist. All of the above. Q7. There has been an outbreak of the norovirus in your clinical area. Majority of your staff have rang in sick. Which of the following is incorrect? Do not allow visitors to come in until after 48 hours of the last episode. Tally the episodes of diarrhea and vomiting. Staff who has the virus can only report to work 48h after last episode. Ask one of the staff who is off sick to do an afternoon shift on same day. Q8. Evelyn, 57 years old, suffered from a very dense left-sided cerebrovascular accident stroke. She was unconscious and unresponsive for several days with 4 fluids for hydration. Since her recovery from stroke, she has been prescribed to commence enteral feeding through a fine-bore nasogastric tube, in which she signed her consent in front of her who have always been supportive of her decisions. However, she tends to pull out her NGT when she is by herself in her room. She died of malnutrition after a few days. Which of the following statements is true? Nurses should have the empathy to listen to more than just the spoken word. Nurses should practice in accordance to Evelyn's best interest while providing support to the family and listening to their concerns and wishes. Evelyn needs to be supported with questions related to mortality and meaning of life. Therapeutic communication is also essential. All of the above. Q9. Tom, 48 years old, has been exhibiting signs and symptoms of anaphylactic reaction. You want to make sure that he is in a comfortable position. Which of the following should you consider? Tom should be sat up if he is experiencing airway and breathing problems. Tom should be lying on his back if he is assessed to be breathing and unconscious. Tom should be sat up if his blood pressure is too low. Tom should be encouraged to stand up if he feels faint. Q10. The following are ways to remove factors that trigger anaphylactic reaction except for one. It is not recommended to make the patient should not be forced to vomit after food-induced anaphylaxis. Definitive treatment should not be delayed if removing a trigger is not feasible. Any drug suspected of causing an anaphylactic reaction should be stopped. After a bee sting, do not touch the stinger for about a maximum of 3 hours. Q11. Which of the following is the most important in infection control and prevention? Wearing gloves and apron at all times. Hand washing. Immediate prescription of antibiotics. Use of hand rubs in the bedside. Q12. Olivia is 86 years old and has been in the nursing home for 5 years now. She has been complaining of burning sensation in her chest and sour taste at the back of her throat. What would she most likely to be prescribed with? Ranitidine, Zantac, paracetamol, levothyroxine, A and B, BND. Q13. Sophia has been prescribed with estradiol tablet to be inserted twice a week at night. You entered her bedroom and noticed she is fast asleep. What would you do? Try to gently wake her up and insert her vaginal tablets. Allow her to get some sleep and try to insert the vaginal tablet on your next turn rounds. Speak to her and ask her to spread her legs so you can insert her vaginal tablet. Document that the tablet cannot be administered at all because the patient has refused. Q14. Christine cannot get herself a drink because of her disability. Her carers only give her drinks 3 times a day so she does not wet herself. What type of abuse is this? Physical abuse, institutional abuse, neglect, sexual abuse. Q15. Mrs. X was taken to the accident and emergency unit due to anaphylactic shock. The treatment for Mrs. X will depend on the following except location, number of responders, equipment and drugs available, triage system in the AE. Q16. You are currently working in a nursing home. One of the service users is struggling to swallow or chew his food. To whom do you make a referral to? Tissue viability nurse, social worker, speech and language therapist, care manager. Q17. You are working in a nursing home, morning shift, and one of your residents is still in the hospital. Nothing has been documented since admission. What would you do? Ring the family and find out what happened to the resident. Speak to your manager and tell her about it. Ring the ward and request for an update from the nurse on duty. Document that the resident is still in the hospital. Q18. Which of the following is an open-ended question? Do you enjoy the activities in this care home? Do you like the food in the ward? Would you like me to take you out for a walk in the garden? What are your favorite activities in the home? Q19. Charlotte has been very physically and verbally aggressive towards other patients and staff for the last few weeks. She is now on one-to-one care, 24 hours a day. According to her person-centered care plan, the nurses are looking after her very well, preventing her from causing any harm. Behavior has been discussed with the social worker, and clinical lead has applied for DULS. Which of the following is correct? DULS will allow staff to intervene, depriving Charlotte from doing something to hurt herself, other residents and staff. DULS refers to protecting the other patients only from Charlotte's destructive behavior. DULS protects the nurses and doctors only when providing care for Charlotte. DULS protects Charlotte only from committing suicide. Q20. The following are ways to assess a patient's fluid and electrolyte status except pulse, blood pressure, capillary refill and jugular venous pressure. Presence of pulmonary or peripheral edema. Presence of postural hypertension. Biomarkers. Q21. One of the following is not true about a delegation responsibility of a medication registrant. Nurses are accountable to ensure that the patient, carer, or care assistant is competent to carry out the task. Nurses can delegate medication administration to student nurses on supervision. Nurses can delegate medication administration to unregistered practitioners to assist in ingestion or application of the medicinal product. All of the above. Q22. Mrs. X is 89 years old and very frail. She has renal impairment and history of myocardial infarction. She needs support from staff to meet her nutritional needs. Which 4 fluids are recommended for Mrs. X? Consider prescribing less fluid. Consider prescribing more fluid. Either of the above. None of the above. Q23. Charlotte has run out of Cavilon cream. You have noted that her groins are very red and sore. You can see that John has spare Cavilon tubes after checking the stocks. What will you do? Borrow a tube from John's stock as Charlotte's groins are red and sore. Use Cane's 10 for now and apply Cavilon once stock has arrived. Request for a repeat prescription from the GP and have the stock delivered by the chemist. Ring the GP and ask him to see Charlotte's groins, then prescribe Cavilon. Q24. What are the 6 physiological parameters incorporated into the National Early Warning Scores? Respiratory rate, oxygen saturation, temperature, systolic blood pressure, pulse rate and level of consciousness. Biomarkers, oxygen saturation, temperature, systolic blood pressure, pulse rate and level of consciousness. Oxygen saturation, temperature, systolic blood pressure, pulse rate, level of consciousness and edema. Temperature, systolic blood pressure, pulse rate, level of consciousness, edema and pupillary reaction. All of the above. Q25. Which of the following is not a criteria for anaphylactic reaction, sudden onset and rapid progression of symptoms? Life-threatening airway and/or breathing and/or circulation problems. Skin and/or mucosal changes, flushing, urticarial and angioedema. Skin and mucosal changes only. A and B only. All of the above. A, B and C.